Hello friends, I'm Dr. Sachin Kulkarni from Sunanda IVF and I also work at Jahangir Fertility in Pune. Let me just tell you a small story. This couple visited me a few days back and they were married for 6 years and they were going treatment for infertility for a period of 3 years. During this treatment course, they had taken about 3 or 4 times cycles with letrozole and clomiphene, and afterwards somebody advised them to go for intrauterine inseminations. So they did about 3 IUI cycles at 2 different centers. So totally about 3 cycles, one at one center and 2 at the other center were done. I went to the IUI reports and they were pretty good. They were taken proper treatments. Every time they had formed about 2 eggs, but every time the sperm motility was low. So I was surprised at that the motility is keeping low. 3 IUI have failed. I said, well, the natural course of event will be to go for IVF. I was about to counsel that, but then I said, wait a while, I really want to know why you are having such a low motility, and have you been investigated for your low motility of the sperms? He said, well, nobody has investigated me for that. But then, I said, well, let me take a proper history for you. And then when I asked him, his wife came out saying that he's a tobacco chewer. She was an intelligent lady. She had read about the tobacco could decrease sperm motility. I said, how long are you chewing tobacco? And he says, well, I'm working in a factory which demands heavy work and all the workers there chew tobacco. And that's why even I've started chewing, it's difficult to give up. So herein, a couple, because of sheer chewing tobacco, I feel, is suffering from asthenospermia because his count were 26 million and 34 million, but the motility was hardly 10% and 6%. So total motile sperm concentration was coming to just 4 million and 6 million. That's why the IUIs were not giving us more success. And just because everybody was concentrating on 3 IUI failures, she was getting about to be advised to go for an IVF. But actually the attention needed more by the husband. If he stops tobacco, I'm sure his count and motility will go up within no time, maybe just 6 months or 8 months. But during these 6 months and 8 months, this wife will maintain a normal ovarian reserve because she already has a normal ovarian reserve and she's a very good responder. I think this is very, very important to go into the depth of a case before making jumps over to going for IVF for shallow reasons of just 2 or 3 IUI failures. We need to go into the depth of the situation, understand the situation, or just right-click refresh kind of stuff. Understand the whole thing again and then formulate a strategy ahead to manage these patients. Thank you.